Hello, hi, and namaste. My name is Pratibha Paudel. Welcome to News Nepal exclusive English program related to improving the health of women, initiated by Dr. Binod Bindu Sharma, Laureate Professor Roger Smith, AM, and Miss Annie Smith. This program includes a range of activities from providing access to health service and education to promoting healthy lifestyle for the overall development of women at large. Specific initiatives that are included in this women health development programs are maternal health and child care, reproductive health, nutrition, mental health, and empowerment. First of all, I would like to warmly welcome to Dr. Binod Bindu Sharma, Secretary and Ministry of Social Development and Health, Gandaki Province.
Thank you. Thank you.
Next, we are here with a distinguished personality, Laureate Professor Roger Smith AM, and he is currently involved at Hunter Medical Research Institute, the University of Newcastle, Australia.
Namaste.
And we are here, with Mrs. Annie Smith, and she is currently involved in promoting maternal health care in Nepal and as well as in Australia.
Thank you. Namaste.
Okay, before entering into the actual subject matter, I would like to wish you a very happy Holi, a festival of color. May your life be full of colors of happiness and joy, and it is still being celebrated in Tarai region. Yesterday it was celebrated in Kathmandu Valley, and today it is celebrated in Tarai as well. And I would like to wish you a very happy Holi.
Thank you.
Thank you.
Happy Holi
Thank
to
you
you
too.
Thank you so much. Okay, Dr. Binod Bindu Sharma has been working in women health development program that aimed at improving the health and well-being of women for more than, for more than 20 years. Okay, and you are working here for more than 20 years. And would you like to share the experience related to this program, and would you like to give an overall view of this program?
Thank you. The women health issue is very important that we need to address. In our cultural settings in Nepal, women are considered the second graded citizen. So I felt that this should not happen. As we respect our mothers, sisters and daughters, we should also respect and care our daughter-in-laws. So that was my young age feeling. And in my past time, I experienced that I lost some of my loved ones due to maternal complications. So I was thinking that why don't I work on this particular field? So when I graduated and started working with the government, I realized that this is the area where I should be focused. This is the area where I contribute. If I contribute small amount of time, I can save numbers of women. So thinking this plan in mind, I tried to apply for PhD program, trying to improve maternal outcomes. So I applied to University of Newcastle, Australia, and Professor Roger was my principal supervisor. He accepted my proposal and I went to the University of Newcastle, Australia. And during my PhD studies, we had wonderful program to educate the communities, to empower communities with knowledge. And we found that there are three particular delays in causing maternal death. For example, delay in decision making, delay in realizing the problem of the women within the family. And second delay is delay to reach the health facility from household. So the transportation delay. And third delay, once the women reaches to the health facility, the health facility is not prepared at once to provide the service that she needs. So these three delays causes maternal death. So we work on these three delays. For example, we empower communities with knowledge so they will decide on time, and we introduce the helicopter programs to rescue the women with obstetric emergencies, so that addresses the delay in transportation, delay in reaching the health facility, and also while transporting to the health facility, we inform to the hospital team so that they are prepared to start the services required. So this is how we have been working on this, and more than 600 women have been airlifted since 2018, since we initiated the program in Nepal. So almost 4 women a week been rescued by helicopters. This is very exciting outcome.
Okay.
Thank you.
And were there any kind of social or cultural barrier access into maternal health care by the women in the community in Nepal?
Yes, Pratibha. This is very prominent cause that the women's issue is not well discussed in the family. For example, the pregnancy particularly is not discussed because it is matter of women and it is private issue, and the men in the family are not kind of related to this issue, because the pregnancy, childbirth, menstruation are the issues that are women domain, and men are not involved in this issue unless men are involved and they are responsible in managing providing care for pregnant women. The pregnancy cannot be safe. The maternal outcome cannot be improved. So we, as part of our intervention, we encouraged the community men to be involved. For example, we designed the song with the 4 key messages in the song, and the songs were sung in the community in house-to-house environment, and we include the teachers who are very credible sources of information in the community setting. So we involved teachers to sing the songs with maternal, pregnancy and childbirth related messages in the community, and this is how we encouraged the men to be involved in managing pregnancy and childbirth issues. So we empowered community with the knowledge that is sustained. Okay. Thank you, Pratibha.
That is really interesting. With the help of singing and dancing, you initiated that. Okay, and I would like to move towards Mrs. Annie Smith. And what is your view towards Nepal's women condition, health condition, I mean, and how would you compare this to Australia's women health condition?
Thank you, Pravita. When we were here at the end of the program, visiting the villages, it was very obvious that women were not participating fully in the families. Talking about menstruation and periods, that didn't happen. In Australia too, that has gradually changed, but it's a gradual process. But certainly it was perhaps more obvious here that was not happening. Sorry, what was the other part of the question?
Okay. They are shy about the menstrual process, and they do not share these kind of things in Australia as well.
Yes. Well, yeah, I guess it's been a gradual process, but it has been shared, I suppose, earlier in Australia. But it is important that it affects the whole family, and also introducing this program. Women having the access to the sanitary napkins enables them to continue at school, and so that they can be educated, and and therefore they can contribute to the workforce.
Okay, thank you so much. And now I would like to move to Professor Roger Smith, and I would like to know what were the challenges you faced while working to provide antenatal care in remote areas in Nepal?
Sure. Throughout the world, maternal mortality is a big problem in low and middle income countries. To give you an idea about how bad it is, in Australia, about 6 women die in every 100,000 births, while in developing countries the number is 600.
Okay.
So it's 100 times worse. And because in Australia we know it's only 6, it means all those deaths in developing countries are potentially preventable. So they're unnecessary deaths. So when you think about promoting the well-being of women in Nepal, the most important part of well-being is being alive.
Okay.
And so you can't do anything if you're dead.
Oh.
So trying to solve that problem is really important. And as Binod has said, it's not an easy problem to solve. And the reason it's not easy is that there are 3 parts. You have to get right if you're to save women. You have to make sure that the family, the local community can recognize when a woman's at risk. Then you have to be able to transport her quickly to a good health facility. And thirdly, when they arrive at the health facility, they have to get looked after straight away, not left waiting and bleeding, for instance, in the waiting area. And unless you solve all 3, the woman will still die. So it's a little bit like a rickshaw's wheels. You need all 3 working for the rickshaw to work. It's no good having 2 or 1 working. All 3 together have to work. And when you need something like that to happen, it is a challenge to the organisation of a community. And that's why Dr. Binod Bindu Sharma's work is so important as a public health official, putting in place the public health measures to make sure the system works to save the life of the woman. And it's so exciting to see over 600 women saved by this program, and a further 3 to 4 every single week. The system's not perfect. We can, I'm sure, in Nepal do better. But from my perspective, it's exciting to see this working in Nepal, because now I can take that message to other countries where the maternal mortality rate is high and say, this is the way to solve the problem. They've done it in Nepal. Maybe now in Indonesia you could do it this way, or Kenya, or Ethiopia. So it's exciting to see what's been accomplished in Nepal, and Nepalese people should be very proud of their achievements in this area.
Okay, it's a really impressive work, and as we know that Australia is a developed country and their per capita income is more than $60,000, and can you highlight some points regarding the Australia's women health strategy?
Sure, but as you've said, the situation in Australia is very different to the situation in Nepal and other developing countries. We have excellent roads for good transport. We have excellent access to obstetricians and midwives to help the ladies. So I think what's required in Nepal and other developing countries is a different approach that understands the reduced income. But when you take military helicopters and repurpose them to save women, it doesn't cost your country anything. So it's a very cheap solution. You would think it would be an expensive solution, but it's not, because you already have the helicopters and the pilots, and the same sort of thing exists in other developing countries too.
Okay. And I would like to move to Dr. Vinod Bindu Sharma. What was the provision before? Did they receive any kind of education or information about antenatal care and pregnancy from healthcare providers before the community, and they used to get such kind of education program or not before, and how are you giving that? Where they used to receive the education program before?
You are right. We didn't start the program from the zero. We did have the public health offices in each district, all 77 districts, and these public health offices are responsible to educate the communities, and they used to organize educational program through radio, television, and maybe print media. So actual messages were not targeted to the illiterate communities living in the remote districts. They were out of reach of television, out of reach of FM radios, and the print they can't read and write. So we further complemented the effort of the public health offices that they were doing, that we went in the village and we designed the program in a way that they are fond of, in Nepal, people are fond of singing and dancing, and we can communicate through songs, so many things. For example, within the family, the people or women can sing to message in satiric way to the men. For example, we have Rataulis, and in Ratauli, the daughters-in-law or women can communicate to the master of the house, the men, that you are not treating us well. So we figure out that the singing and dancing is the key medium to communicate. So we embedded health message to educate the illiterate communities. And the interesting fact that after 1 year of intervention, the message provided by singing and dancing were still remembered by the illiterate community, and they were equal to literate men or women. So it is most effective way to communicate the illiterate community. So we complemented what were been done in the field of public health education in the communities.
Okay, that is very interesting. Yeah, and now, Annie Smith, you were involved in different kind of singing and dancing programs related to health and antenatal program, health and antenatal program. How was your experience related to this? How they shared their experience related to this dancing program, and were they excited or not? I would like to know that.
Yes, thanks, Pratia. Yes, it was very exciting, and I was warmly welcomed. This is in the villages of Ramja and Chitra. The women, I guess, or everyone really, were very encouraging for me to participate in the dancing, and it was very exciting. certainly enjoyed it very much, and I think hopefully that helped to include, sort of everybody, sort of as well into the program. But yes, the dancing was very exciting, going through the villages.
I would add that for the first day, she hesitated to stand and start dancing. Once she started dancing, she caught the rhythm of the song and the way the local women were dancing, and she danced like anything. She afterwards, if we could measure the quality of dance, she could have been the first. So
Thank you, Vinod. It's very kind. No, you're very kind.
People, the whole community was moved. Whole community was, the community itself was the musical one. So we went house to house and we used the local town crier. We call Gokni.
Okay.
Yeah, we use town crier to inform the community that we are coming to your village with the songs, and people were and they were waiting us. You see the interesting fact, I'm sorry to add, that the community that we didn't organize the intervention, we created control population, and these control villages and the adjoining villages, they asked us to come to their village with the songs. So we were almost compelled to take our intervention to their villages.
Okay, so
And
that
I
is
think
interesting.
this is exciting to think about, as women around the world face the same problems.
Okay.
And so I think Annie was a representative of another country's women, and the villagers were very welcoming of that and accepting another woman dancing within the group in the spirit of sisterhood.
Okay. And how was it scheduled? I mean, once a week or twice a week or once a month? How was it scheduled, the dancing program? It's really interesting, I find it.
You see, it was as part of our research program, and initially we organized a song competition amongst the community groups, and they came with their popular melody embedded with health songs, and we had 26 groups competing in the song competition. So we selected 6 best songs to take to the community, and we organized about 1.5 months together to reach all the wards, all the communities. And if there is one isolated house, we reach to that particular house to sing and educate the family members.
Okay.
So it was not in periodic way, but to complete all the household, we took about 1.5 months to complete the program.
Okay.
And I think one of the interesting things is that they only had to hear the songs once, and they remembered the messages for more than a year. So it's a very powerful and effective technique. As you were suggesting, do they come back each week or every month? If they had to do that, I think it wouldn't be very effective. It would require too many health workers. But if it can all be done once and everybody remembers it, that makes it very effective. So the message was very powerful, and I think it was partly because of the singing and dancing that made it so powerful.
Okay.
And it reached the whole family too. It
Yes.
was, it was from the young to the old, and men and women. They were all there.
It became a kind of refreshing program as well, and they were excited, I think. And Ajuni, that you are working in remote areas, and this means that most of the people are unemployed there, and we know that in Nepal more than 25% people are under poverty line. And how you manage financial problems of theirs, or what was the budgeting system? I mean, how did you manage this kind of things, financial problems?
I think the way it was handled, and Binod will know this in detail, is that if a woman required a helicopter retrieval, the government provided money to help that woman get back to her village. So there are a number of things instituted to make the problem, to make the handling of the financial problem easier for the villages. Is that correct?
Yes.
Most of the people are involved in agriculture and they do not have employment. They do not earn money. They are undernutrition. Was this the problem? And would you like to add something for this? And how did you manage?
In the village where we organized the intervention, they were not that poor, but their employment was agricultural based. So we involved men and women for one day, maybe in their house, in their community. It was the case of one day intervention. So, and not full day, but in village setting, we used to go to one village, have a program, maybe 1 or 2 hours singing and dancing program, and they used to go back to their work.
Okay.
So, but we as a team intervening the program, we used to go house to house, village to village for 1.5 months.
Okay.
So cost-wise, we did pay to the team who were involved in singing and dancing and teaching the community. We did pay to those members involved, but we didn't pay to the community people.
Okay.
Yes.
Okay. Okay, I got that. And I would like to move to Annie Smith. And what kind of menstrual hygiene practice are common in your community? I mean, in Australia, and what difference or similarities do you find in comparison to Nepal?
Fine. I guess, I mean, women use sanitary products, you know, whether it was tampons or pads or, but women in Australia have been able to participate fully in schools. You know, they could still go to school and be involved in sports, although that, you know, that is problematic for women in different sports. But here in Nepal, it was obvious that women were not allowed to go to school, I think, I understand, and also they were kept separate as well. So, you know, there were certainly big differences there.
Thank you, Annie.
Okay.
This is a very important point, that considering the Nepal's case and the girls' issue to complete their education, to continue their education, even during period, you know, the girls in the rural areas, they do not have access to the healthy devices like sanitary napkins.
Okay.
So we introduced in Gandaki province, with the help of Ministry of Social Development, we included 30 government schools to provide with free sanitary napkins. We invested 10 million Nepalese rupees on this pilot, and we experienced that the outcomes of free distribution in the government schools is exciting. And we, along with Professor Rosa, Mrs. Annie, we came to the federal government parliament, particularly the women parliaments, and we workshopped with them, and we show that how did we produce the good quality sanitary napkins with the help of the trainees. We trained in the communities, and they were distributed to the school children, and we lobbied to the federal government that this is an important program. It needs to be expanded throughout Nepal. So the proposal was considered by the government, and now with the help of that pilot organized in Gandaki province, now 1.3 million Nepalese girls have been benefited with free sanitary napkins. However, this should be improved, and the women in local governments, for example, mayor, deputy mayor and executive directors, they have to be very responsible in this case, because the girls in our community setting, they don't take the sanitary napkins in a public way, in an open manner. They have to be hided, because the cultural setting is such they are not prepared to take the napkins in open. So they are hiding and taking the napkins being freely distributed. But the quality is very questionable, and unless the local government authority, mayor, deputy mayor and executive officer are responsible to make sure that the quality of the napkins is good, we can't improve this program. So, and the girls do not come to our office, do not come to us complaining this is not good quality napkins. So we need to work on this. The system has been initiated, but we need to make more improvement in this sanitary napkins distribution program.
Okay.
Point.
Okay, you're welcome.
If I could add, this is a problem throughout the world. So even in Australia, disposal of sanitary napkins is a problem.
Okay.
And our water board is faced with the problem of sanitary napkins blocking the drains. And they don't speak freely about it, even in Australia, that it's a problem of sanitary napkins. They call them wipes, which is like a code, because they're, even in Australia, not prepared to say sanitary napkins.
Okay.
So addressing these taboos around menstruation is a global problem, not just a Nepalese problem.
So it is called COB.
They call them wipes on the
Wipes.
television ads. But they're not wipes, they're sanitary napkins, but they don't like to say the truth. And it's very important for young girls growing up to have sanitary napkins as an acceptable thing to talk about, because menstruation is a normal part of body function and physiology.
Yeah.
Girls shouldn't feel embarrassed about this subject, but they will feel embarrassed while we skirt around the subject and give it different names to try and cover up our own embarrassment with the topic. But it's a global thing, and as Annie said, it's changing gradually. 20 years ago they wouldn't have even mentioned wipes, and now they're talking about wipes. Maybe in 5 years and 10 years in Australia they'll talk about sanitary napkins, and maybe the same thing will happen in Nepal. I remember your own program where we displayed our sanitary napkins, and I bet that was the first time in Nepal such a thing happened, and it wouldn't be done so easily in Australia either.
Okay, it is a
So you
problem.
were really setting the pace there.
Okay, and I would like to move to Annie Smith, Mrs. Annie Smith, and what is the cost of sanitary napkin in Australia, or is it free of cost, or we should buy it?
No, they're not free in Australia. No, you need to buy it, and but they're all disposable, or mostly disposable. I understand. I believe so. As we've talked about, it's a problem. Disposing of them is a problem. It's an environmental issue. Having reusable ones is obviously, a huge benefit. But no, we do have to pay for them.
And how much do they cost?
Oh gosh. Sorry. No.
You don't show the cost.
Yeah, no.
Okay.
I don't know the cost.
No.
And maybe I should.
Yeah,
maybe in
no.
the future the men will go out to buy the sanitary napkins, and then they'll know the cost,
No.
perhaps.
Have you ever purchased sanitary napkins?
No. But maybe in the future I'll get a chance to do that.
Okay, and what is your future plan for this program? Have you made up mind for any other programs related to this women health? I mean, are you adding some more other program for women health?
Thank you, Parthiba. It is very important topic. That as we have initiated the air retrieval program, we need to improve this system, air retrieval system, that the community is aware of, that the provisions are there, and the helicopter pilots should also be oriented, and the hospital team receiving the women should also be prepared well, and all these issues should be worked together, and the care provided in the hospital should be well documented. This is one of the improvement aspect of the air retrieval program. Another, we need to work to improve the sanitary napkins distribution program, to make the sanitary napkins quality ones, and disposal system, and the recording system, and the financial transparency is ensured. This is another. And to top these programs, we are aiming to organize maternal waiting homes in each district hospitals where birthing facility is available. For example, if we find any high-risk women in the community during the antenatal checkups, we pick them up before they start their labor. For example, we pick them up 2 weeks earlier their expected date of delivery, and we host in a maternal waiting home. We feed them well, we observe in a daily basis, and we provide them training with essential health issues, for example, baby care and postpartum care, and the family planning issues. For example, she is newly delivered, so that could also be important one. So establishing maternal waiting home will also complement to improve maternal deaths in Nepal. And we would like to make our antenatal checkups qualified in the remote areas. To make that happen, we need to train our auxiliary nurse midwives on the USC technique. For example, we normally call it video X-ray of those pregnant women to ensure that the women is going to be normally delivered, and if there is any issue, then we will give further attention to address the issues. And thirdly, we would like to make sure that each women go to hospital for delivery, no home deliveries. That is our mission. And lastly, to improve the maternal outcome, we would like to initiate special programs to prevent child marriages.
Okay, thank you so much.
I think that's where the sanitary napkins come in too. If the Nepalese schoolgirls have sanitary napkins, it makes it easier for them to stay at school longer, to become better educated, to delay the age at marriage, to delay the age at first pregnancy, to improve their education, improves their career opportunities. And you talked about unemployment in Nepal. Better educated girls are going to be able to do more jobs and build up the economy of Nepal. So providing sanitary napkins to schoolgirls has enormous benefits for the society of Nepal. Economic returns that will be so valuable for the country. It would be foolish not to give the girls sanitary napkins. It would be destructive to the society. The other area that I'm interested to hear in the future is about domestic violence, because again, this is a global problem for women, and I know it's a problem in Australia, and I suspect it will be a problem also in Nepal.
Okay. Wish you all the best for your future success. Okay, and we are at the end of this program, and Thank you so much for sharing your views on women condition and how they are benefited from your program. This program of yours is a perfect motivation and encouragement for those who want to work in this field. And I wish you all the best for the future progress, and your project would go 1,000 miles ahead of this. And I would like to wrap up this program, and thank you so much for coming. Now we are at the end of this program. Keep watching News Nepal television. Thank you so much. Namaste.
Yeah, namaste.
Thank
Namaste.
you.
Thank you, Pratima.